Damage to this structure causes Erb's palsy. Upper trunk of brachial plexus. Damage to this structure causes Klumpke's palsy, claw hand. Lower trunk of brachial plexus. Damage to these nerves causes wrist drop. Posterior cord or radial nerve. Damage to this nerve causes deltoid paralysis. Axillary nerve. Damage to this nerve causes winged scapula. Long thoracic nerve. Damage to this nerve causes difficulty in flexing elbow, as well as variable sensory loss. Musculocutaneous nerve. Damage to this nerve will result in loss of dorsiflexion, foot drop. Common peroneal, L4S2. Damage to this nerve will result in loss of plantar flexion. Tibial, L4S3. Damage of this nerve will result in loss of knee extension, knee jerk. Femoral, L2L4. Damage to this nerve will result in loss of hip adduction. Obturator, L2L4. Damage to this structure will result in right onopia. Right optic nerve. Damage to this structure will result in bitemporal hemianopia. Optic chiasm. Damage to this structure will result in left homonymous hemianopia. Left field lost in both eyes, right optic tract. These are the only two muscles of the eye not innervated by the oculomotor nerve. Lateral rectus, innervated by abducens, and superior oblique, innervated by trochlear. Damage to this area causes nonfluent aphasia with good comprehension. Broca's aphasia. Damage to this area causes fluent aphasia with poor comprehension. Wernicke's aphasia. Damage to this area results in tremor at rest, chorea, or athetosis. Basal ganglia. Damage to this area causes Wernicke-Korsakoff syndrome. Mammillary bodies. Damage to this area causes truncal ataxia. Cerebellar vermis. This disease is associated with beta-amyloid plaques and neurofibrillary tangles. Alzheimer's disease. Parkinson's-like disease associated with aggregated tau proteins and specific for frontal and temporal lobes. Pick's disease. Associated with chorea and dementia due to atrophy of the caudate nucleus. Huntington's disease. Associated with Lewy bodies and depigmentation of substantia nigra. Parkinson's disease. Olivopontocerebellar atrophy results in this syndrome. Friedreich's ataxia. Degeneration of both LMN and UMN with no sensory deficits. Amyotrophic lateral sclerosis. Inherited degeneration of anterior horn cells resulting in flaccid paralysis and tongue fasciculations. Werdnig-Hoffmann disease. Degeneration of anterior horn cells resulting in LMN signs, often in association with flu-like symptoms. Poliomyelitis. Paraventricular plaques with oligodendrocyte loss and reactive gliosis. Relapsing remitting course. Diagnosis. Multiple sclerosis. Progressive multifocal leukoencephalopathy is associated with this virus. JC virus in AIDS patients. Inflammation and demyelination of peripheral nerves causing symmetric ascending muscle weakness. Guillain-Barré syndrome.